Hello, I am Dr. Sudhakar Rao, Consultant Cardiologist, Manipal Hospital, Sarjapur Road. Today, I am going to talk about life after a heart attack. Heart attack is a life-changing event in anybody's life. Let it be a youngster in their 30s or a middle-aged person or an old-age person. Heart attack by itself is a term which most of us would like to ignore. At discharge after a heart attack, your instructor or healthcare provider will provide you with the information about how to change your lifestyle, what medications to take, about the cardiac rehabilitation and your risk factors. In the next few minutes, I am going to brief you about the important aspects of this. So, the first and the foremost thing and the most important thing is about the medications. After a heart attack, you will be given a blood thinner, a medication to decrease your cholesterol, and some medication to increase your heart pumping if you have a lower EF. You should make sure that you should not stop any of this medicine by yourself. Self-medication is not advisable, and even if you have a small fever, you should not take medications by yourself, except sometimes a paracetamol or a crocin or a dolo. Taking any other painkiller may have an adverse effect on your heart or the kidney. The second important thing is about the risk factors. And when I tell risk factor, it includes diabetes, hypertension, obesity, cholesterol, and smoking. Now coming to the diabetes, if you are a person with diabetes, your target should be a fasting sugar of less than 100, a postprandial sugar of less than 140, and a 3 months average sugar, that is HbA1c of less than 6.5. If you are not a diabetic, you should maintain your HbA1c of less than 5.7. People who have a heart attack should always keep their blood pressure in control, that is less than 130 by 80 mm of Hg. When you have a heart attack, you should always maintain your cholesterol, that is the bad cholesterol or LDL, less than 70. And people who have developed more than one attack or you have more than one stent should always keep their cholesterol to less than 55. It is better to keep your BMI less than 24.5 in any situation, and any form of smoking, let it be active or a passive smoking, should be avoided. Now coming to the most important aspect, that is the cardiac rehabilitation. Many people ask, how much should I walk after a heart attack? So it's always a graded form of exercise. You can walk 10 minutes in the morning and 10 minutes in the evening for the first 2 weeks. In 2 to 4 weeks, you can walk 15 minutes in the morning and 15 minutes in the evening, and after a month you can resume your normal activities of at least 10,000 steps per day. Now, can I climb stairs is the important another question. You should try to avoid in the first 2 weeks after heart attack climbing too much stairs, except once or twice a day. Even if you climb the stairs, it should be you walk for few stairs, stop and then resume it. People often ask, can I travel after heart attack? You should avoid air travel at least 10 days or 2 weeks after heart attack. If you are using two-wheeler, avoid it for a month, and if you are using four-wheeler, avoid it for at least 2 weeks. Now coming to another important concept, the diet after a heart attack. If you are a diabetic, you should avoid too much sweets in your diet. Fruits, you should know which one to take and which one not to take. If you are a hypertensive, try to avoid too much salt, and the use of salt less than 2.5 gram per day is advisable. If your heart pumping is low, that is the LV ejection fraction less than 40%, you should avoid drinking too much of water, and it is advisable to use only 1 to 1.5 liter of water per day. Avoid any form of red meat. You can use fish, which has lot of polyunsaturated fatty acids. Again, using oils which are saturated fats should be avoided. You can use oils which has polyunsaturated fats or monounsaturated fat. Now coming to the last and the most important aspect, which is the social aspect. Most people after a heart attack may go in the form of depression or a denial and finally an acceptance. It is always better to get involved in some form of yoga or meditation, and when we call yoga, it is better in the first month to avoid the extreme form of yoga, something like Kapalbhati, though you can use breathing exercises. Always try to involve in other groups like people who have developed heart attack. Try to talk with them, counsel them and informate and educate them. So this is all about life after a heart attack. Thank you.